Our next speaker is Dr. Radhika Tandon, and she'll be talking about research at the Apex Institute.
Thank you and good evening, everyone. I'm going to try and give an insight into the research at the RP Center in the very short time. Everybody is familiar with the RP Center, where we have, as with all other institutes, a combination of patient care, teaching, and research. And we have the emblem, which represents what we do, the motto of Tamsoma Jyotirgamay, and our anthem. So, the late Professor L.P. Agarwal established the center, and his vision is so rewarding even today. We've had a whole host of chiefs who've carried his message forward and brought us to this point of time in 2021. It serves as a temple of learning and a fountain of knowledge and is an oasis for patient care. But talking about the research aspect is very much a part of what we do. Giving you a little insight into how the
Tamsoma Jyotirgamaya. From darkness to light. Dr. Rajendra Prasad Center for Ophthalmic Sciences was established by the Ministry of Health and Family Welfare, Government of India, in 1967 as a National Center for Ophthalmic Sciences to provide state-of-the-art patient care to the common man. Dr. L.P. Agarwal, the founder-chief of the center, was a visionary who envisaged a standalone comprehensive ophthalmic center that would be at the forefront of the eye health planning, academics, and clinical care. The center is a constituent ophthalmic services unit of the All India Institute of Medical Sciences. Dr. RP Center is spread across a standalone 7-floor building as 300-bedded facility catering to a footfall of more than 5 lakh patients per year. Dr. RP Center has the largest ophthalmic residency training program in the world, with over 250 ophthalmology residents training in basic and advanced ophthalmology, with 47 faculties, comprising of 6 clinical units of excellence, catering to different ophthalmology specialities, clinical services to retina and uvea, cataract and refractive, cornea and ocular surface, ophthalmoplasty and ocular oncology, squint and neuro-ophthalmology, ophthalmic anesthesia, and ophthalmic-related basic sciences of community ophthalmology, ocular pharmacology, and microbiology. This center is also one of the leading facilities in the country, publishing medical literature on clinical and basic sciences research. Unit 1 caters to cataract, refractive and pediatric cataract services, along with retina and uvea services. A large volume of children of all ages with cataract is examined and operated upon providing them with optimal visual rehabilitation. Unit 2 caters to retina and uvea, along with ROP services. All advanced and complex retinal surgical treatments are available. The special pediatric neonatal unit caters to comprehensive ROP services for the premature babies with retinal problems. Unit 3 caters to cataract and refractive cornea and ocular surface services. World-class facilities for femtosecond assisted cataract and refractive surgery is performed in high volume throughout the year. Unit 4 caters to glaucoma, squint, and neuro-ophthalmology services. Advanced care facilities for glaucoma clinical, laboratory, and research facilities are accessible to all patients. Unit 5 caters to squint, neuro-ophthalmology, and oculoplasty services. Children and adults with a wide variety of squint problems and complex neuro-ophthalmology disease are thoroughly examined and taken care with the world-class surgical procedures. Unit 6 offers to cornea and ocular surface, cataract and refractive services along with ocular oncology services. State-of-the-art facilities in corneal transplantation with all recent advanced surgical procedures, keratoprosthesis services, and stem cell transplantation services are possible here. Ocular oncology, inclusive of comprehensive retinoblastoma care services, is provided, serving more.
So, as you can see, there's a whole range of facilities, and the research is linked to what is going on. I'll just give you a snapshot of what we've done, say, according to the annual report of 2019 and 20. A lot of the work is clinical, but also we have research which is pre and paraclinical, involving community ophthalmology, optometry, and vision sciences. Apart from the research which is done in-house, there is also outreach work for the National Program for Control of Blindness. There are several surveys which are conducted. There is the NPCBVI National Diabetes and Diabetic Retinopathy Survey which has been done, plus the National Blindness and Visual Impairment Survey 2019. A national survey on human resource and infrastructure for eye care services in India. And now there's a Vision Atlas. This website is available and accessible if one wants to know the updated data on national blindness and visual impairment surveys. The elimination of active trachoma has been confirmed by the survey conducted by the RP Center for the NPCB, and a community-based survey for the prevalence on the childhood causes of blindness has been published recently. Operational research using ASHA volunteers as well as a multi-center collaborative study are just few of the other examples of research going on. As you can see, it's a huge institute with a lot of people, and the research output, we have several research projects ongoing and completed, and the publications for the last year were 390 papers and innumerable abstracts. Of course, the institute is led and the work is led by the very, very talented and dedicated faculty, not to forget all the students as well as staff. So with that, I'll stop here, and I hope I've been able to cover a peep into the research work going on at the Apex Institute.
Thank you, Dr. Radhika. That was very nice. Normally you have most of the corporates showing you what all work in the different departments, and it's nice in you we've had today of our Center. Thank you very much.